Good morning, good afternoon, everyone. We would like to welcome you to the 269th webinar of what was originally Stop COVID Deaths, which has transformed into health updates under TVUP. And it's really great to have everyone here to see familiar names. And I'm sure, on the chat, I can see those who are greeting us. But welcome, welcome, and thank you so much for being part of our credible online community. And to all of those who have just discovered us today and those who are watching on the playback, welcome to everyone. I think when it comes to children's health, catching problems early makes all the difference. Many common pediatric conditions, such as poor nutrition, inadequate vaccination, asthma, vision or hearing problems, autism, developmental delays. These can occur in children who look relatively healthy. So parents may not think that, there's something that needs to be done, but there are conditions that start rather quietly and may not be obvious. So it is important to have some kind of screening and monitoring over a period of time, especially for those kids who are under the age of 5. In the Philippines, these early screenings help children get the care they need before small problems become lifelong challenges or surprises. And because early interventions can really make a big difference in the way a disease or a condition will play out. So it's very important that we are all aware of what everyone can do to help every child have a healthier start in life. So screening is not just about finding illness, it's also about protecting growth, learning, and overall well-being. So we've got two great speakers, two very established and highly esteemed colleagues in pediatrics who are going to speak today. This is Health Updates program, and I am your host, Dr. Susie Mercado. And it's always a pleasure to be with all of you on our regular Friday lunch date. And it's my pleasure and honor to co-host this program with the head of the Integrated Training and Research Unit at the Philippine General Hospital, also a surgeon. Maybe you don't know that, but she's a surgeon. Dr. Dion Sakdalan. Dion, welcome and good afternoon.
Hello, good afternoon, Doc Susie. It's also a privilege and an honor for me to co-host this webinar episode with you today. Good afternoon po sa inyong lahat, sa ating mga suke, ang ating palaging ka-Fridays, and hello to everyone, not just in Zoom, but also in the TVUP YouTube channel, as well as in the UP System Facebook page and the TVUP Facebook page. Of course, there are also people watching in the TVUP Signal, TV Channel 101. Good afternoon, everyone. So, as mentioned by Doc Susie, we have a very interesting topic for today, and we are also honored to have two esteemed pediatricians in the country, and we will give us a lot of information that hopefully our parents in the audience will make use of and put action into those information so that we can better take care of our children. So Dr. Susie mentioned about our guests. So we have Dr. Ces Alinea. She's a professor of pediatrics in the Philippine General Hospital, and she will help us understand which pediatric condition should be screened for or when screening should happen, and how families can work with health providers to keep our children healthy, active, and thriving. We have our reactor for today, also a pediatrician, Dr. BJ Sablan. And I look forward to a very interesting discussion. And of course, we hope to answer your questions as well.
Okay, so to provide context to the topic, TVUP has interviewed persons on the street to understand, how people see the issue of screening. Why would you need to screen a child who's actually healthy? So ito yung mga tanong, no? Kailan niyo huling dinala ang anak niyo sa doktor nang wala siyang sakit? Bakit? Importante yung tanong na yun, eh, di ba? Dion, kasi parang kung may sakit, dadalhin sa ospital. Parang gano'n ang thinking natin, ano? By the way, kami ni Dion, ano kami ha, mother and daughter tandem.
Sisters
Kaya
lang,
kitabi natin,
doktora.
tabi natin, ganon. Mother and daughter tandem kami ni Dion. Anyway, so, typically, you bring your child to the hospital pag may sakit. Pero hindi dapat ganon. I think that is the thing, no? Saan yon saan nanggagaling ang impormasyon sa tamang pagpapalaki ng inyong mga anak? Ganda nun, ano? Meron ba kayong nababalitaan na programa na kailangan para sa screening na ginagawa sa ating mga anak? Sa tingin nyo, kailangan ba ito? Bakit o bakit hindi? So let's watch this Person on the Street by TV.
Yung last check-up nila is last Friday for vaccine doon sa youngest namin na si Tiffany.
As far as I remember, last month, December, before her 7th birthday.
Hindi ko naman kasi talaga gustong magpa-hospital. Kung magagamot naman sa herbal lang talaga.
May pina-follow kaming vaccine. So, every month, meron kaming mga tinatapos na vaccinations for the kid. Yun lang, yun yung pinaka-purpose ko.
And then, hindi na rin siya na-vaccinan because of may sipon siya tsaka ubo.
So I went to her pedia for a well-baby check-up. So far, there's nothing more serious and she's growing up well naman. So no problem. So well-baby check-up. So yun, as much as possible, I bring her to her pedia at least once every 3 months.
Sa kalinisan ng pagkain, kalinisan ng bahay, kalinisan ng kapaligiran, may vitamins.
More on doctor talaga. So, always yung doctor yung sabi, parang may binibigyan na booklet ng pang kids. So, ano yung mga nandoon na vaccine, yun lang ginagamit.
Actually, yung information para maging healthy yung mga kids, mostly through online. Yung mga experience din ng mga other mommies, sa Instagram threads, Facebook, tapos yung sa doctors din, and of course yung sa mga real life experience sa mga other mommy na friends din.
Since ngayon, we have social media, so first source of information is really social media, Facebook. And there are a lot of influencers so nasa Facebook, pediatricians, general doctors, and doon ko po nakukuha yung mga informations about raising kid well. So yung ganun.
So, regarding doon, kapag nagkalagnat, pumunta lang din kami sa same doctor namin for the check-up.
Actually, ang familiar lang ako sa newborn screening. Aside from that, wala na.
I gave birth last 2018, so newborn screening. If I think it's really familiar now for parents, for mga bagong parents. So that's newborn screening. We did that before with our child.
Hindi pa po. Kasi pag nagpapacheck up po kami, parang sa labas lang kami, hindi talaga kami nag-switch. Kaya sabihan lang kami.
Okay. More on, parang check-up din. As in screening, parang check-up din. Ganun yung dating sa amin.
And then vaccination. So dapat importante yung newborn screening information, knowledge about newborn screening, and yung how to raise a kid well. That's very important.
Parang mga vaccine, mga vaccination, mga proper ways, yung mga kung kailan sila pa-vaccinan. Parang yun lang yung idea ko sa screening.
Given naman na ngayon, marami na tayong sources of information. So it's very important to, as much as possible, do some research. And yes, yung goal natin is to raise a healthy child.
Thank you very much, TVUP. And I think that gives us some insight, no? Anong iniisip ng mga ordinary people, how they think about it. Very young parents, no? But very interesting. So, let me see. What are we doing next? We have certificates. Sorry. Si Raymond kasing gumagawa nito eh. I'll just cue the certificates of attendance. For all those who are asking, certificates of attendance will be given to those who have watched at least 50% of the webinar duration. And if you have some issues with that, please put it in the chat. So, Dion, over to you to introduce our speakers.
Yes, so I'm very honored to introduce our speaker for this afternoon. As mentioned, she's a pediatrician. Actually, she's one of our senior residents before, but eventually she became a junior consultant when I was still in PGH as a trainee. She's from the Department of Pediatrics, and the division chief of, so sorry, the division chief of the section of general pediatrics. She's
Yes.
also the vice chair for academics, postgraduate, and the vice chair on the committee on undergraduate pediatric education curriculum. So, professor po ang ating unang guest to talk to us about the screening options and how to better take care of our kids. Please welcome Dr. Cecilia Alinea. Good afternoon, Ma'am Ces.
Good afternoon, Dion. Good afternoon, Dr. Susan. Good afternoon, of course, to all our viewers in TVUP. It's my first time to be here.
Welcome.
Thank you, Dr. Susan. Dr. Susan and actually our actor, Dr. BJ Sablan, are very good friends and
Classmates.
extremely wonderful mentors, no, from the UP College of Medicine. So Dion, we are in good company. So
I agree.
very honored po, very honored, very humbled and grateful, of course, to be guesting here. Thank you, of course, to Dr. Stella for this kind invite. So I was very amazed at siguro po kasi I have a way of doing things when I check up my patients, and they do know that screening is very important. But it's true, no? I think many parents and caregivers are not aware, especially our charity patients. And it's really good to have those perspectives, no? Hearing those perspectives from the mothers.
Sige, Dr. Ces, go ahead.
Apa, okay. So ma'am, game na ako?
Yes.
Oh,
All right.
the floor is
Sige.
yours.
So, all right. Thank you very much. So, again, let me show my screen.
Yeah, your screen is, it needs to be on
Okay.
presentation mode. You're good.
Apa, okay, we're good. Thank you, Dr. Susan. So, again, magandang hapon po sa ating lahat. If you're eating your lunch, just spare me one side of your eyes and your ears. And hopefully, we get, of course, for our seasoned healthcare providers, perhaps this is just a review. But for those who would want to get to know more, about screening, hopefully this presentation would do just that. So, alagang maaga, iwas sakuna. This is pediatric screening made simple. So, these are my disclosures. So, for this afternoon, hopefully at the end of this presentation, we would all have a better understanding of screening and its role in taking care of children and know its importance. No, it's not actually a new thing. It has always been embedded in the regular checkups of children, but there are actually key times or key ages when these screenings are being done, and we do it in the Philippines. They're covered by PhilHealth. So it should be something that is very doable and very feasible. No? So let me just define first what health screening is all about. So they're not just laboratory. So they are activities that are being done, for instance, between the doctor and the child, with the parents. No? And these are also services that are provided. And this is to enable, no, the doctor to be able to prevent, no, certain disorders or conditions from happening, or being able to detect it. No? So it can be diseases or certain developmental conditions. And we really do this early on, also since infancy. But the purpose of since I was only given 30 minutes, let's limit up to kids less than 5. No, so they do come in various forms. So for healthcare professionals, we know that in our history, we can actually give questionnaires, and we're already doing screening. No, in our physical exam, that's also one way to check for this, and we can also perform laboratory tests. So this is, again, I want to reiterate, a standard component of pediatric practice. So tuwi pong magpapa-check up yung mga bata, no? This is part of the set of activities, no, the doctors would do with the family. So in your regular health supervision visits, no, or checkups, you would usually have a well child or an asymptomatic child. And whenever they come and visit, of course, we do our history. And very important for kids is to do your measurements or your anthropometrics, because it's through here that we get to check for physical development, no? And of course, we do a thorough physical exam. From there, we can also do sensory screening. So we check the senses, but there's something wrong with vision, with hearing, etc. All areas po where we can see some problems like in development, social, behavioral, or even mental health, no? Na medyo nauso po talaga since the pandemic. Of course, there are procedures that are done at a timely manner. Oral health is something that we do not forget, very important po. So it's not just the dentist who does this, no? And of course, we provide anticipatory guidance. So it doesn't just end that there's a problem, but rather, if there is or there is none, it's important that we guide the parents so they continue to be our therapeutic partners. So this is our goal, no? So our goal is, so since they come in normal, we want to identify children who are at increased risk of disease, no, or some sort of condition, and would this warrant further testing? Or we can do early referral, or we can already do early intervention. No? So we do not want them to end up being morbid. And these screening tools, no, or these screening activities should be easy to perform. Kaya po kasama po talaga siya sa regular health supervision visits. No? They all should be easy to interpret. So let's say you just have your secretary there, no? Our allied head, medical professional should be able to do this. So it's also supposed to measure something that is related to disease. No? So kung mag-check pa for hypertension, of course, we take the blood pressure. And last but not the least, our screening activities and tools are supposed to be low risk. They're supposed to be safe. No? They should not cause any morbidity. And of course, they should be cost effective. No? So otherwise, since it's just screening, remember, hindi naman po panigurado ito na meron na po talagang sakit. And if it's costly, no? And especially if it's not very safe, then we might not be able to do it. No? So there are guides, no, for us to be able to conduct our screening tests. So in the US, no, so I would always refer to the American Academy of Pediatrics. They're one of the greater advocates no, of screening. No? So the American Academy of Pediatrics has what we call your periodicity table. So I'm sorry, this is a very busy table. But as you can see there, for every age group, no, there would be, it would indicate what and when to do screening in children. No? And they also have what you call your bright features guidelines. And this would tell us how it should be done. Okay? But of course, for us Filipinos, we also have one. So the Philippine Pediatric Society, which is our professional society, also has the Preventive Pediatric Healthcare Handbook. And we also have the periodicity table over here. No po? And of course, this is the one that would provide information on what and when we do screening in children. But we also have the Pinoy version of our bright features, and this is what we call your bahaghari. No? So this is the one also that could guide us on how we should do our health supervision visits and the screening that go with that. No? So it's done in the Philippines, no, and there are guides for us to be able to conduct this. So, but I also want to reiterate that the DOH, no, has actually done. They have provided us with the Omnibus Health Guidelines, and this is some summary. No, so it's a summary of the screening tests that we should be doing in children. So as you can see in this table, no, so they prepared for us a list of non-communicable diseases that are supposed to be screened in children. So as you can see, no, your autism spectrum disorder is part of that. Your anemia. So minsan sasabihin lang po nila, maputla po yung bata, doktora, may anemia po yan. No? So there's a way on how we will be able to accurately, no, and appropriately screen for that. Even your dental caries, no, down to hypertension. So on the next column, you would see when they are supposed to be done and what are the risk factors, meaning what other ages, no, when it should be done if these children have do have the risk factors, and of course, what will be done. No? So for anemia, you're supposed to do a CBC because you look at the hemoglobin. For your autism spectrum disorders, for instance, there's actually a screening tool that we ask parents, no, to accomplish. And of course, we score it, no, and it is from there that we decide, no, if the child needs to be referred or not. Okay, so down the line. So there are actually more. No? So the omnibus also shows us that we have to screen for metabolic disorders, visual defects, and even infectious diseases. And more so in the Philippines, of course, would be tuberculosis, no? Because we know that children easily get infected by adults. So, baka naman yung think, says, parang so much to remember, no? So, let me just siguro put it in a more practical way, no? I prepared three cases that would represent three ages where we do a lot of screening, no? So, let me start first with our newborn. So, we have baby Liam here. So, he is actually a full-term newborn. Wala po naman siyang problema, no? The mom is a 29-year-old premi-gravid, did not have any comorbidities. So the baby was born with an APGAR score of 99, no perinatal complications, was actually discharged well after more than 24 hours. So if you were the primary care provider, no, who's taking care of Liam, what would be the screening, no, that you should be conducting? So this is a list. So I based this on the guidelines. No, you remember I showed you the periodicity tables, no, of AAP as well as PPS, and those are actually embedded in the omnibus guidelines. So if you're going to do history, no, you can check for atopy. So ito po yung mga namamana na mga allergies. No? For your anthropometrics and your measurements, of course, we measure all these things, no, to check for physical development. For sensory screening, I want to highlight your hearing screening for your newborns. Napanood din po natin yan kanina, no, from the moms on the streets. So we can also check for screening for developmental delays, for social, behavioral, and mental health screening, although not much po yan, syempre, for your newborn. Wala pang masyado nangyayari. In our physical exam, we check these things. But for procedures, you know that we do the blood test. Na ito po yung mga for metabolic disorders. And we also do the CCHD, or the critical congenital heart disease. Of course, immunization is there, no? And your hepatitis B and your BCG are actually administered at birth. So, anticipatory care, no? Dr. Susan mentioned earlier that we want them, of course, to have good nutrition. We want them to be safe. We want them not to be exposed to toxic substances. We want them to be treated well. And these are the anticipatory these are the anticipatory guidance that we will provide the mother. So let me just go through the newborn screening tools. No? In terms of indication, they're all indicated for newborns. So your newborn blood test or your metabolic disorder screening would screen for metabolic disorders that are usually hereditary. For your hearing screening, it screens for deafness. So sometimes parents don't know how important it is, but there are actually kids by 6 months of age hindi ho nagsasalita, no? Or they are delayed, no? When it comes to their expressive language, and that's because they don't hear anything. And if they don't hear anything, they won't be able to copy sounds, no? Kaya po sila hindi nagsasalita. So it's very important to do your hearing screening. And for your CCHD, this actually looks into the possibility that the child may have critical congenital heart disease. So, crucial age, no? Hopefully, while they're still in the hospital, no? So after 24 hours, we do our metabolic disorder hearing screening, usually before discharge, but you can do it up to 2 months. For CCHD, usually we do it before they get discharged or after 24 to 48 hours. So if the results come out to be positive for one or more, no, of the diseases that are there, usually we do first a confirmatory test, no? And then if it is confirmed, then of course we refer. No? So for your hearing screening, you can already see it if the child passed, no? Or needs to be referred from either ear. And if there is a refer result, it's actually repeated, no, within the first month of life. And if it is still problematic, then we really have to do further testing, and we usually refer this already to ORL, no, or your ENT. So your CCHD is very easy to do. You just put your pulse oximeter on your right index finger and your right toe. And if the oxygen saturation is more than 95%, then this means we don't have critical congenital heart disease. No? So this is very important because your metabolic disorder screening can detect potentially fatal or disabling genetic diseases. As Ma'am Susan said earlier, no, they actually might look very normal to us, but the screening will help us detect these genetic diseases that can only be seen if we do the screening test. So for your hearing screening, no, we can identify those with hearing loss early on, so we can do early intervention, and this would prevent delays, no, when it comes to speech, no, especially yung expressive language. And for your CCHD, if they do have problems, no, remember this would require special treatment because these are congenital heart diseases, so we refer them early, and so we can prevent disability as well as death. So other areas of screening that we do in the newborn, you can screen for atopy. Simple lang po, no? It's just in your history. You just ask for history of allergies or asthma, food allergies, of course, if there are indications, but usually when they're bigger. But you just do your history, no? And so you'd know also how to better care for these kids. So in your visual screening, usually po what we do for your newborn is a red-orange reflex, no? Because if you don't see it, you might have catastrophic conditions, no, like your retinoblastoma. So you check, of course, your corneal light reflex, and of course, you check for fixation. For your prematures who have been exposed to 100% oxygen for quite some time, then we check for retinopathy. So your newborn bilirubin, no, is really just to check if we do have problems with hemolytic anemia. So especially if the onset is before the 24th hour of life, then that is really problematic. But beyond that, and the child is healthy, we shouldn't have any problems. No, we do have a bilirubinometer in the Philippines. So we have one at the Philippine General Hospital. So our residents use it left and right, just to make sure that these kids do not need early intervention, no? So we can prevent problems. So what about if the child comes in at 1 year of age? So this is baby Joshua, no, who comes in actually just for a health supervision visit. So wala rin po siyang problema. If you will look at his development, no, actually good motor, fine motor, language, as well as socio-adaptive milestones, no, medyo at par po sila. He doesn't have any current infections. You can see that in terms of his diet, maganda po siya, no, because all the food groups are represented. He drinks water from the sippy cup, okay? So seems to be quite a normal child. So, but still, no, hindi lang po bakuna yung gagawin natin dyan. We still continue to do our screening, no? So in history, you would still ask, no, if there would be manifestations of possible atopy. You still do your anthropometrics. You still do your sensory screening, no, when needed. But what I want to highlight for this particular age group is they need to do your developmental screening, no, or your surveillance or your developmental monitoring. You can also do screening for these areas, and you can actually also do ASD screening, but this is usually for 18 months and above, okay? But I'll still discuss it. So for our healthcare partners, of course, to be more cognizant of that. Of course, you do your physical exam. For the procedures, we just continue with our immunization. And I'm highlighting this with this particular age group because in the health center, the kids will only be given vaccines up to 1 year of age. And parents might not know that we actually continue to administer vaccines beyond 1 year of age. No? And of course, for those with high risk, we also screen for lead. We do our Mantow test or our PPD, no? And of course, our urinalysis. For oral health, we want to highlight the first dental visit because the dictum usually impedes is first dental visit during the first birthday, no? So at least naman po may dalawang ngipin na po yan, no? Or at least you'll have 4 already up and down. And it would be good to take care of them, no? Because we don't want to wait for problems like dental caries, no? For the parents to go to the dentists. And of course, we continue to provide for anticipatory guidance. I just want to highlight about deworming, no? Baka akala po ng mga tao, no, this is really just done if there are really worms passing out of their kids. But this is very important for prevention, no, to keep our kids healthy. And I also want to highlight about screen use, because I think it's now one of the predominant concerns of parents, no, because now it's being used as an e-yaya or electronic yaya, just to keep the kids settled and calm, no? Because when they are watching, the parents or the caregivers get to do other things. But we would include this, no, as part of our anticipatory guidance, no, of course, to keep our patients healthy and safe. So I want to deal first with developmental monitoring or surveillance versus your developmental screening. So as you can see here, who can do your developmental monitoring or your developmental surveillance? So of course, the primary care provider, but we also tell the parents, the grandparents, all the primary care providers to also do this. Because basically what we are looking at is making sure that they meet their developmental milestones in those ages when we should be seeing them. No? So very important, especially during kids 5 and below. And this will help us actually see, no, if your child is doing well, then good, we celebrate. We talk about their progress. We talk about how we can further enhance. We then teach, no, what to expect next. No? So kung dati gumagapang, ang susunod na po dyan, they pull themselves up to stand, they will cruise around the crib, and then eventually stand up. No? So the parents would know what to expect. And then, of course, if they're having concerns early on, we can hear about it. Okay? So there are checklists, and I will show you one later on. And so they are free. This is something, of course, that we can do even before, no? So we can ask parents actually to fill them in, no, or accomplish before they come over. And this is compared to screening. No? So screening, we also give as some sort of questionnaire, no, to parents and caregivers, or the healthcare provider can also ask it, no, or even the early childhood teacher. Because usually, no, these may be kids who are at risk. And so we do the screening while they are in their well child visits to make sure that we will detect them. So part of this is your autism screening, which is being done on your 18th, 24th, and your 30th month of life. So if your child needs more help now with development, it's good to do these screenings, no? Because they might not always be obvious. And if there would be further evaluation that would be recommended, it would be good that we know when to refer them, of course, with developmental pediatrician. So there are formal, validated screening tools that are available, no? And we can also ask the parents or primary caregivers to do that. So the goal of developmental screening is to identify subtle risks for developmental delays. And as we mentioned, we do have tools for that. No? Your general developmental screening tests are done on the 9th, 18th, and 30th month visit. And then I mentioned, of course, for autism on the 18th and the 24th. No? So I want to show you your PEDS response form. So this is actually, so PED stands for Parents Evaluation of Developmental Status. And this is usually being conducted for ages 0 to 8 years of age. So if you notice this, no, these are very simple questions. For instance, do you have any concerns about how your child talks and makes speech sounds? No? So simple lang po. Or what are your concerns about how your child understands what you say? So they'll just circle this, no? So this allows us to address such concerns, no? And they cover language, motor, self-help, early academic skills, behavior, and social, emotional, and mental health, okay? So down the line, so you can see here, do you have any concerns about how your child is learning in preschool or school skills, no? So the questions, no, would also be accomplished, no, depending, of course, on the age of the child. So what's important is that, so for the healthcare provider to be able to score, no, so there is a scoring form, and then you actually would have, so based on the score, they will be falling on different paths. And for each path, you will have some algorithm, no? So this is the one that would tell us if we need to refer, let's say, to an audiologist or a speech language, or they need speech language testing, or we need to refer already, let's say, to a developmental pediatrician or to a neurologist or a SPED expert. No? So what's important is that once we get the information, we know what to do. No? So we can refer them in a timely manner, of course, to the appropriate specialist. Okay. So again, to highlight immunization. So as I mentioned earlier, in the health center, only vaccines, no, are being administered during the first year of life. Kulang pa nga po, wala po yung rotavirus. But as you can see, from your first year, no, from 12 months up to 23 or 24 months, marami pa po. No? So there are still boosters of the primary vaccines, no, which were given during the first year of life. But you also start giving your varicella. No? You can also give your hepatitis A. So it's good, of course, to continue this, no? So we can complete, of course, the protection of our kids, no? From diseases that are actually common in the Philippines. So there are a lot of sources of information. So as you can see, in the health center, konti lang po talaga, no? So you can always be guided by these references when you're giving it to kids 1 year and above. So other areas of screening that we can do, no, when they come in at 1 year of age. So the AAP has your behavioral, social, emotional health screenings in the form of your ages and stages questionnaire. So you can also just Google them, no, the questionnaire, and this would actually help us look into possible delays, no, in the aspects of your social, emotional development. And these are in terms of communication, autonomy, affect, and interaction with people. So we also do screening for oral health, no? So as I mentioned, may ngipin na po talaga pagdating ng 1-year-old. So we do advocate, no, that they visit the dentist, not because they have problems, but because we want to do anticipatory guidance and prevention of dental caries. So use of your fluorinated toothpaste. Akala po ng mga parents, we cannot use toothpaste, no? But remember, we need the fluoride. So for younger kids, for infants, usually po bahid lang ng toothpaste, no, that you can even apply with your hand. For your toddlers and your preschoolers, you use your pea size, and of course for your bigger kids, it's the whole length of the bristles of your toothbrush. No? And we also have your fluoride varnish. So for your manto test, no, or your PPD, this is being done most especially for those who are at risk for TB, no? So for those who have exposure, those with defined risk factors, but universal testing is actually not recommended. So I just want to show everyone your ages and stages questionnaire. I'm sorry po, my updated na po. There's already the ASQ3. So as you can see, it's very similar to your PEDS form, no? Very simple questions also. Does your baby laugh or smile at you or to other family members? Okay. So down the line, so for instance, in this particular bracket, these are questions that look into socio-emotional development. No? So basically, what the parent will do, or the primary caregiver, is that if they see not this behavior often, always, sometimes, rare, or never, then they pick that. Okay, so you can see here that even eating and sleeping habits, no, are actually looked into because they may be part and parcel, no, of certain bigger problems, even what worries, no, the parents about their babies and what they enjoy about their baby. So again, there's a scoring tool. Our goal is 50 or less, no? But when you go beyond the cutoff, so this means that there may be certain things, no, that we need to further investigate on, or monitor, or even refer on. So your MChat is the screening tool that we do to check for autism. No? So it's a 20 yes or no question screener, and we would usually give it to 16 to 30 months old. So actually, we're giving it to 18 and 24-month-old children. And what's important is that it's not really being answered to give us a diagnosis of autism. Rather, we screen it. No? And what's important is that so there is a score, no, from the 20 questions. What's important is the primary care provider looks into the score. So the lower the score is, the child would probably be low risk. But for those who are getting higher scores, of course, follow up. Eventually, they would need to do that on the 24th month, no, after doing it on the 18th. And from there, we should see if the child needs to be referred or not. No? So again, we would be very timely, no, and we will be referring to appropriate specialists for that. So other areas to screen beginning 1 year old would be a possible, no, for lead toxicity. So usually 6, 9, 12, 18, 24 months, and of course older, but especially those who are at high risk of exposure to paint, soil, drinking water from lead pipes na kunwari po hindi pa napapalitan, 70s pa yung mga bahay, no? Many of them are actually created from lead pipes. No? So it's important. No? They could be high risk, no, for lead toxicity. So even some consumer products, some foods, cosmetics, no, and even certain jobs, of course, for older people. And if there's a possibility for renal disease at early age, we can actually do our urinalysis, of course, to screen for kidney diseases. So I want to highlight also about screen time. No? So if you look here, for those under 18 months of age, experts recommend avoiding all screen time except video chatting with loved ones. So if Lolo and Lola, no, are FaceTiming the baby, that should be okay. But as much as possible, what we want for older kids is that they see you face to face, they see your mouth opening, they hear, no, they hear your songs, they hear your voice, and so this is the one that they would copy, no, and this is the one that allows them to attend to you. And if you see here, no, given the various age ranges, how much of the screen time is allowed. So actually, even up to the 24th month, none is still ideal, no? Pero less than 1 hour per day na lang po, no? So we don't want it too long because it's what's better is the child would actually communicate, no, with people around them and explore, no, his or her own environment. So we limit it usually to 1 hour, after up to 2 hours, even up to those 11 and above. But what I want to highlight is what kind, no, of content should the kids be exposed to. So always, it has to be high quality educational content. So nowadays, experts and specialists would actually advocate more about this issue. No? So minsan po, sometimes we really cannot stop parents, no, for exposing kids to screen earlier than 18 months. So what we just tell them is just to make sure that you provide high quality educational content and you co-view. No? So when you're there, hindi nyo lang po iiwan yung bata. You can be there, you can ask questions, you point to the pictures, no, or moving objects that you see in the screen. So, because remember, their ability to be able to process things on screen might not be as good, no? Because it depends on their age. Okay? So of course, these are things that you have to avoid. But what is being espoused now is that, especially for older kids, is create a family plan for healthy media use. No? So maganda, it could be a way for families to bond. No? So you can watch movies together, you can talk about it, no? As long as, of course, they are of high quality educational content. All right. Purga, syempre po, is very important for 1 to 2 years of age. So in the local health centers, we have this, no? Albendazole is the one that is available, but there's also mebendazole, 500 milligrams, so that you can also buy in drugstores. So for 2 to 4 years of age, it's the whole tablet. But for the younger ones, 1 to 2, is just half a tab, single dose. Pero nagpupurga po tayo 2 to 3 times a year, no, for kids 2 to 14 years of age. So our last case is Brianna. So she comes into you as a 3-year-old healthy baby girl. So coming in actually for your usual visits, but she also has a 2-day history of cough and cold. So of course we take care of that. But what the mom said is that she missed her health supervision visits since she was 2, no, because they transferred houses and she needed a lot of catch up, no. So we know that this would be part of those that we screen, no, and of course do something about it. In terms of developmental monitoring or surveillance, so far she's actually at par. Okay, so what will now be the preschooler health screening list? So again, still, no, the ones that we saw in our periodicity table. But this time, since she's already 3, it's important for us to look into the body mass index or the BMI. And we really do our blood pressure monitoring already starting this age. No? We also do vision screening at this time. So sometimes you will have teachers from preschool telling you, Mami, yun pong anak mo, nagsa-side view, no? Just to look into the board, no? Or sometimes they have to go nearer, or they have difficulty writing, yun pala they cannot see, no? So it's important to do your sensory screening of your vision. Of course, you continue with your developmental surveillance, your physical activity. For procedures, we continue with your immunization. And of course, you still do your oral health and your anticipatory care. So let me discuss briefly your body mass index. No? So we know this tells us the measure of our weight in relation to our height. No? So tama po ba yung timbang? No? Based, of course, on the height of the child. So we all know that there is a formula for that, no? But you can already get the calculator in your website, so it's easier for you to compute. Okay, so basically, what we will be looking at would be your BMI percentiles. So basically, we're looking into your child's growth in relation to children of the same age and sex as that of the child. No? And from here, we will be able to figure out if compared, no, to the rest of the population, the same age and sex, your child actually is within the healthy weight range. No? But of course, given other medical information, no, we would see what we need to do so we can achieve healthy weight. So if the kid is less than the 5th percentile, usually the kid would fall into the category of underweight. Your 5th to the 84th would be your healthy weight. Your 85th to the 94th would be your overweight, and above your 95th percentile, you might have your obese kids already. No? So it's very important, of course, to catch them early on, and of course, to do early weight management for these children, no? So we can prevent comorbidities. So in terms of blood pressure, as you can see, they are measured annually for kids, no, beginning 3 years of age, and this is a universal recommendation. So also for those who are obese, who are taking meds that are known to increase your BP, for those who have kidney problems, for those with cardiac problems, and for those with diabetes. No? So our goal is to detect, of course, hypertension early, and we should diagnose them, no, using, of course, the appropriate instruments. And what we want, no, in terms of its impact on wellness, is we want to prevent long and short-term hypertension-related morbidity, no? So we can usher them into adulthood as well individuals. No? So we also prevent cardiovascular morbidity, no? Because if there is, let's say, a family history, no, kids can already be predisposed to that. So it's good to screen them early on. So I mentioned about vision screening, no? So we do it at age 3, but we also do this yearly and even anytime. So the goal is really to detect for amblyopia, no? Or if there is uncorrected amblyopia risk factors. And so these kids would be able to see well, no? And of course, enjoy their usual activities. So there's a critical line, no? So hindi pa naman po perfect na 20/20 yung vision nila. At 3 years old, no? Usually 20/50, 4 years old is 20/40, and 5 years old is 20/30. So usually between 6 to 7 years old pa po talaga yung 20/20 vision. But of course, if it's worse than these, then we have a problem. No? So this is the periodicity schedule, no, for visual system assessment. So I want to focus here now, no, yung visual acuity fixate and follow responses. So as you can see, as they are actually getting bigger, dapat po kasi they're able to fixate, no, and follow. But beginning age 3, there are age-appropriate optotype assessment. So, yun pong optotype tools, ito po yung nakikita nyo with all the letters, no? With a certain distance, and then you cover your eye and you start reading them. So we can do this for kids even as young as 3 years old. So some of them who can identify already the alphabet. So these are the more common alphabets that they readily remember. And so we can ask them to read it, no? So your shapes, no, are also there. So these are your optotypes, or there are those that would have your common objects, no, are pictures, or the letter E, and then you just ask them to vary the position, no? Because if they see it well, then they should be able to copy the position. Okay? So this is something we can do, of course, in our clinics. So hearing screening, no? So of course, for all ages, the most basic is your evoked autoacoustic emission. And so if there would be problems, no, we know when, of course, to refer to our specialists for that. And the last one would be for screening, no, for your 3-year-old, would be screening for anemia. So especially for those who have poor nutritional history, or they have a past or family history of anemia, we do our CBC between 6 to 24 months, at 2 to 6, and at 10 to 19. So 10 to 19, especially for girls, now we're having menstruation, especially those who would have problems, no, with their periods. So we take the complete blood count, and then this is when we refer, no? So if there's severe or worsening symptoms, if there's lack of response, no, when we treat them, especially if this is iron deficiency anemia. So if it returns without an apparent cause, because you might have problems na congenital, baka po yung mga thalassemias, no, or your other hemoglobinopathies. If there's a family history of your blood disorders, and of course, other blood conditions. So this is the WHO definition of anemia, no? And this is based on your hemoglobin. So for your 3-year-old, it should be 110 and above. So if they go less than this, then of course your kids would have anemia. So you just have to identify what's the cause and do something about it. Or of course, we can refer to our specialists. Okay? So to summarize, no? So pediatric screening, as you can see, is something that you can do during your health supervision visits. Hindi po siya isang extra visit or isang extra activity. No? So you can do all these during checkups. So it allows the doctors to detect early if there are problems in the physical, behavioral, social-emotional, and mental aspects, and even the developmental processes, no, that you would monitor in children. And so if we get to detect early, we can either do further testing, or we can already do early intervention so we can prevent them, no? And of course, maintain well-being, or we can refer in a timely manner, no? So we can prevent comorbidity. So we use age-dependent, standardized, and validated tools, no, for better outcomes, because they are standardized, no? Hindi po siya very subjective, no? Because it is something that is being used universally. So this will allow us to have better decision making, no, when it comes to the child's condition, and then be able to do, of course, the appropriate next steps. And last, no, but not the least, for children aged than 5, this is an opportunity, no, when we do screening, to be able to detect also potentially fatal and disabling conditions, because they might really appear to be okay, no? But then again, these conditions can negatively affect the quality of life. And so if we catch them late, then of course we might be able to actualize that goal of keeping them healthy. So again, no, if we do our screening in a timely manner using the appropriate age-dependent standardized tools, no? And they're always within your health supervision visits. I guarantee you, no, that these kids, no, would have a great chance of life because we will be ushering them into healthy adulthood, no, and of course contribute much to our society. So at any time that you will see your kids and there's a need to screen, let's screen them ASAP and let's not delay. So thank you very much for your kind attention.
Wow, thank you very much. That's Dr. Ces Alinea, who is the division head of general pediatrics at the Philippine General Hospital. And uh, Dion, it's one of those lectures or talks that you would like to go back to. And we're very fortunate that it's recorded. Thank you so much, Ces. Very thorough. I think a lot of insight into how do we improve the quality of life of children and their families. Now, I think because we are running out of time, I'm going to ask Dion to quickly introduce Dr. Sablan, and we can do a quick little discussion and promise Dr. Sablan that we'll invite him to be presenter next time. So, Dion, kindly introduce Dr.
Yes,
Sablan.
to give a very quick reaction is the division head of ambulatory pediatrics. Please welcome everybody, Dr. Benjamin Sablan Jr.
Good,
Sir John.
good afternoon to everyone. Good afternoon, Susie and
Hi, hi.
Dion. Hi.
So, Dr. BJ, we don't have a lot of time. So
Yeah.
I think what would you say are the main points about screening? And then I promise next time we will invite you to speak about ambulatory care in general.
Oh
What
my
are the
goodness.
main points?
I,
Main
I think
points.
I think from a clinical point of view, pediatrics is one specialty where well children are brought to clinic. You don't see this in adults, diba? In
Yeah,
adults, you have an illness. Pero here, in my practice, I see a lot of well children. So,
yeah,
isipin mo, this is what Cess went through. The
yes,
being well is not just being well, but it's maximizing potential. So you
yes.
see people or parents or grandparents really, how can I maximize the potential of my newborn baby or my child? And that's basically the bottom line why we take a lot of effort in doing anticipatory care when we see children in the clinic. That's
Yeah,
it.
nice, no? I really love it because it's about the whole quality of life, I think, of the child, no? And I think very valuable insight. So we will all go back and listen to this, says. And I think for our doctors out there who are part of district hospitals, primary healthcare centers, this is something you can watch with your team. Again, it's on TVUP. And we will have to close our program because we're out of time. But this is just to thank both of you for being on the program together. And BJ, we owe you one for
Thank
a main
you.
presenter. But thank
Oh,
you so much,
it's
Ses. I
okay.
mean, we wouldn't have it any other way. I think you
Yeah.
really gave us a very good overview of what we need to look out for. And I like that, BJ, that unlike adults, we have to bring the kids to the doctor even if they're okay. So we are going to have next week. Okay, wait a minute. I'm supposed to say something about the shorts, right? The TVUP shorts. Tama ba yun? For those of you who would like to review what has come out, there we are. You can see our previous episodes on the TVUP YouTube channel. And we also have a short version or clips on each of these. There, it's called the shorts, looks like shorts. And the webinar shorts are also now available on TVUP. So please go through TVUP YouTube channel. You will learn a lot and for discussions, for learning, or just updating yourselves. I think next week we will have a speaker on noise-induced hearing loss. So I think this is very good topic also for next week. And we look forward to your being with us next week. It's a date. Go,
So
Dion.
together, let's stay on top of all health updates.
Okay, so thank you very much, everyone, and we'll see you next Friday.
Bye-bye.
Bye.